I don't believe in chiropractors at all. I think it's 98% horse.
Chiropractic, it started out of bull and it stayed directly in bull.
Hi Internet, it's me Myles, and stop me if you've heard this before, but chiropractic adjustment is a scam.
This is a chiropractic teaching video where I will refute the talking points of Joe Rogan, Yvette, and Myles Power. I will do this by explaining the theory of chiropractic and proprioception. This is Miss D'Entremont, who goes by the handle Science Babe and works to debunk falsehoods in alternative medicine. The title of her article on chiropractic, I think, clearly states her opinion of our profession. She was interviewed on Joe Rogan's podcast where they were discussing chiropractic, and she states,
Because there is some minor evidence that you can relieve back pain, lower back pain with spinal manipulation.
I want to start this video off by communicating boldly and directly that we modern chiropractors treat a lot more than low back pain. We treat wrist, shoulders, ankles and feet, elbows, necks, and jaws. Chiropractors treat patients with muscle weakness, balance problems, headaches, vertigo, anxiety, digestive problems, sensitivity to light and sound, PTSD, functional movement disorders, functional neurological problems, and depression associated with proprioceptive deficits. Chiropractic done properly positively improves strength, sleep, peristalsis, proprioception and coordination, timing, adenosine triphosphate production, neurotransmitter output, and mood.
Wow, I feel really, really calm.
How do you feel for starters?
Oh my god. A lot better. Holy.
It also turns down the sensitivity to internal and external stimuli such as vibration, touch, and sound. Decreasing a person's stress levels, allowing them to sleep.
I was 100% better. It's the first time in 4 months I've actually slept well.
Wow.
So massive difference there.
Oh yeah, and I almost forgot, we also treat patients suffering from pain. This is my patient after her last visit communicating what her results were from her previous chiropractic treatment. Notice how she describes her coordination and her timing. We will touch upon these topics many times in this video.
How were you after your last session?
Everything turned on. I was making a majority of my shots. I had a lot more control. I could dribble with my left. Flowing. Even when I'm singing songs on the radio, everything is just flowing. My timing is right. I remember I told you I never had good timing in dance classes when I was young and everything, and my timing is on.
So all with that octave adjustment.
Mm-hmm. Yeah.
Should we check your balance? How excited were you that everything worked?
I started crying. I was shooting the ball, it was going in, I was dribbling, everything was I had control over my body, and I just broke down. I just started crying. And I was on the basketball court, so I was walking away, no crying, no crying.
My goal is to explain chiropractic from a different perspective and illuminate for our critics the error of their understanding. This is our outline with special attention paid to: can adjusting your jaw prevent knockouts, how chiropractic works, does research fail to validate the benefits of chiropractic? As a profession, we have failed to properly communicate how chiropractic works. In our miscommunication, our critics think we believe the original concepts of our founders' pressure on nerve theory. We have a few stragglers, but as a profession, we have moved on. Let us listen to a few of our critics' complaints.
D.D. Palmer is known as the father of chiropractic, but he didn't come up with it. No, he got the information about how to click people's necks from a deceased doctor by the name of Jim Atkinson, who he talked to at a seance.
I'll tell you a story about a guy who was ripping people off. He was doing this thing that he called zone healing. He would touch your head, and he would press your head here, and press your head here, press your head here, and then press it really hard here. And he goes, "Oh, you feel that?" And I go, "Yeah." And he'd be like, "Yeah, that's L4 is off." And this, I'm like, "No, you squeezed hard on my head." And then he would adjust you and tell you that this is going to fix, whatever autoimmune disease you have.
Controlled clinical studies for the treatment used by chiropractors have repeatedly shown that there is no evidence that spinal manipulation therapy is superior to other standard treatments for patients with acute or chronic low back pain.
Okay, our historical foundations are awkward, and our founder was a bit eccentric. Performed seances, as did Miss Mary Todd Lincoln in the White House. We have people in our profession who lack ethics, as do all professions, And according to our critics, there's little to no research we can do much of anything. The difficult thing to do about this video is that Joe, Yvette, and Myles have combined the theory of chiropractic with so many other topics together that it's hard to differentiate what we're talking about. In Yvette's article, she writes about an alkaline diet, manage stress with detoxing, the adrenal gland, adjusting the spines of newborn babies, birthing trauma, stimulating the immune system, vaccinations, buffoonery of a 19th century lunatic, strokes, seances, magnetic healer, pseudoscience of chiropractic, hocus pocus, guesswork, religious beliefs, and back rubs.
I believe in my video I showed that chiropractic adjustment is a complete scam, and I didn't even have to talk about its links with Scientology, the aggressive marketing that is associated with chiropractic, the chiropractic doctors who are a bit touchy-feely, or the massive amount of fraud and just general scams that are perpetrated by these people.
I don't know if you know the history of chiropractic. Chiropractic medicine was created by a guy who was a magnetic healer who came about it through a seance. The idea that he was going to manipulate people's spines and cure them of tuberculosis and blindness. He was murdered by his son, who drove over him with a fucking car.
Only 3 of these items affect our conversation today: back rubs, manipulate people's spines, and touchy-feely. Let me ask you this. Do alkaline diets, seances, scams, fraud, patricide, magnetic healing, aggressive marketing, Scientology, or religious beliefs affect this evolutionary proprioceptive feedback mechanism? To close out this section, I cannot defend or explain every single marketing tactic, religious belief, or idea of chiropractors throughout time. Much like the glaring separation between the theory of medicine versus the practice of medicine, I want to separate the theory of chiropractic versus the practice of chiropractic. I will communicate chiropractic theory from a modern scientific standpoint and show how our critics, and sadly a few of our colleagues, are living in a forgotten era. I want to segue here to showcase how Joe came to his negative opinion of our profession and how he is not alone in picking the wrong provider for his condition.
Went to a doctor. I went to a chiropractor first, which is a fucking giant mistake. I spent a year.
But do you not believe in chiropractors?
I don't believe in chiropractors at all. I think it's 98% horseshit. It's just popping your neck and it just feels good. I went to a guy that's a very nice guy, and he was trying to tell me that I didn't have a bulging disc because he was pushing down on the top of my head and it didn't hurt. I'm like, okay. So I was listening to him. I listened to this guy for like a fucking year. I had treatment with him, and I still had these neck problems and back problems. Then finally I got an MRI, and they're like, yeah, you got a bulging disc. And I remember being angry. Because I was angry that I was being treated by someone who was a professional that really didn't know what the fuck they were talking about.
So one of Joe's experiences was with a chiropractor that had missed something important. Another experience was with a scammer. Of course, these 2 experiences are going to color his perception of chiropractic. Pick the right practitioner. Joe and this woman have something in common. They both picked the wrong practitioner for their specific condition. Joe probably required a physical therapist and picked a chiropractor. She had a chiropractic problem and picked a physical therapist. This patient, a nurse, had neck pain for 6 years. She received physical therapy for 3 years with no relief. Let's listen to her story.
I want to ask her about her neck pain. Can you have her, she went to physical therapy for a lot of years, if I recall?
3 years.
She went to physical therapy for 3 years.
Yes.
And how was that on her neck?
¿Y qué tal le funcionó eso con respecto al cuello?
No benefit. And when did she get the most relief?
Okay, so I felt a lot of tension after work, and I came here for the first adjustment. And after the adjustment on the neck, I felt very lighter, and I could move the neck better.
Remember Joe's story?
I listened to this guy for like a fucking year.
There are 2 lessons to be taught in this section. Picking the right practitioner for your condition will save you time, money, and hassle. How do you know it's the right practitioner? There are only 3 possible outcomes when you see any practitioner. Your condition stays the same, your condition gets better, or your condition gets worse. The standard of care is 2 weeks. 6 to 8 visits within a 2-week period to make an improvement for your specific condition. Not a resolution of your condition, but an improvement. If you're not seeing an improvement in 2 weeks, it's time for x-rays, an MRI, or a new practitioner. Do not stay 52 weeks or 156 weeks. 2 weeks. Now you know. My home base is Southern California, and one of my passions in life is traveling and working at chiropractic clinics around the globe. This is me in Jamaica, this is me in India, and this is me in Lima, Peru. This patient who did not want to be identified was receiving a massage. The therapist wrapped a towel around the patient's head and twisted his neck back and forth 3 times. The patient suffered from a mild stroke. I'm guessing the massage therapist watched some chiropractic crack video and decided he could do the same. When the patient got up, he noticed his face felt different. It felt numb on the right side. He was slurring his speech, and the right side of his face was droopy when he looked into the mirror. He was dizzy, confused, and noticed his coordination and his timing were off. His body no longer responded as it did before the massage. This is why you don't let anyone other than a skilled professional touch your neck. And for those of you who adjust your friends, if you stroke them out, that's on you. This patient had seen several other medical specialists before coming to our clinic. I was hoping that I could make a difference. I tried every trick in my tool bag, and at the end of my 2 weeks, I asked him how he was doing. He responded, he was the same. I told him I was not the right practitioner for his case. Any proprioceptive-based modality, whether it's back rubs, touchy-feely, manipulation of people's spines, massage, rolfing, fascia work, trigger point therapy, osteopathy, physical therapy, chiropractic, or physiatry, are all very powerful proprioceptive tools. A scalpel is a tool. The outcome of that tool's use is also dependent on the individual wielding it. Adjustments or spinal manipulations, regardless of the practitioner delivering it, have powerful neurological implications for patients. In the hands of the wrong practitioner, it can cause serious neurological damage. In the hands of the right practitioner, it can do amazing things. A misunderstanding between discovered versus created.
I had a podcast that I did with my friend Steve Ranella a few weeks back. He goes, what do you think about chiropractors? And I go, so I say, I think chiropractors are bull.
I think they're wrong, but they mean well.
And this is to all you people, and I've got a ton of messages from chiropractors that I'm sure are nice folks. The original guy who created chiropractic medicine was a complete, total bullshit artist.
One of the quotes on how chiropractic started came directly from the book, and he claimed that he cracked a deaf person's back and restored his hearing.
How was the
Hydraulic jaw adjustment?
Yeah, what the hell did you do?
Well, we adjusted it, right?
Yeah.
Feel better?
Yeah. I can hear.
Here's what's important about this. This was created out of thin air.
Yeah.
It was discovered, not created. That is a very significant difference. The original models explaining chiropractic, the pressure on nerve theory, and what chiropractic can cure are obsolete and of a different era.
What is chiropractic? How does it work? And what can it be used to help? This, by the way, is a reason just not for seeing one of these people in the first place, because you never know what kind of chiropractor you're going to get.
Finding a great chiropractor is easy. Look me up at destresschiropractic.com or use the internet to find several great chiropractors in your area. In the next video, I will put to rest the idea that chiropractic does not work and ask our critics to explain how 3 of these adjustments are real, and one of these adjustments is
98% horseshit.
Bullshit.
Scam.